Hello everyone. In this mentorship session, I would like to discuss about the don'ts while studying for medicine university exam. See, in this I will be sharing certain 7 tips or the 7 things that you always have to keep as a priority while you start or before you start reading medicine for your university exam preparation. Number 1, this is actually one of the most common mistake that every student does while preparing for the university exam. That is, they will tend to read only the repeated essay questions in every chapter. I am telling, don't miss to read every essay question in every chapter. This is very, very important because essay questions 15 marks, 2 questions 30 marks. Okay, unlike short note question, you can't manipulate or you can't write elaborately for 15 marks. So make sure in every system, CVS, RS, GIT, CNS, infectious diseases, endocrinology, miscellaneous topics, toxicology, rheumatology, hematology, everything, every chapter, make sure you read every possible essays. Okay, you will be following some question banks. Every essay you have to read because essay question is highly unpredictable. Any question can be asked as an essay and you should manage, you should be able to write well. So in CVS, MI, heart failure, atrial fibrillation, COPD, respiratory failure, DCLD, IBD, peptic ulcer disease, all these are the common questions. This is not the complete list, just I have mentioned the what examples, but make sure every chapter, every essay question you should read. Short notes last 10 years will be enough. In that itself you will be able to write. In case any 1 or 2 questions they ask also, still you will be able to manage for the 5-mark question, but the same you can't do for a 15-mark essay question. Second thing, the second mistake that every student used to do is they won't study the chapter endocrinology. They will study only 2 questions. One is DK, diabetic ketoacidosis, and another one is hyperosmotic osmolar coma, non-ketotic hyperosmolar coma. Okay, that is which happens in type 1 and type 2 diabetes mellitus. So DK and the other one. So these are the 2 questions that everybody will study from endocrinology. But I am telling, last 3-5 years, lots of questions, both the common as well as uncommon questions. For example, hyperkalemia, hypomagnesemia, hyperphosphatemia, hypocalcemia, hypercalcemia management, then Addison's disease, Cushing syndrome, Nelson syndrome, many common as well as uncommon questions. Okay, that too, 3 to 4 questions per paper they are asking in the last 5 years. It is actually one of the, because of the changing, okay, the evolving new branch, that is endocrinology, which is an DM super specialty branch. So to promote awareness among the medical students, even the NMC has emphasized in their curriculum that endocrinology has to be discussed in detail. So because of that, maybe the questions has been asked in detail from endocrinology. Never ignore endocrinology. Please don't go to the exam without studying endocrinology proper. How far importance you are giving to CVS, RS and GIT, the same importance you have to give for endocrinology because the weightage has gone too high. The third question, always whenever you study an essay question, make sure you read under the following heading: etiology, pathogenesis, clinical features with signs, symptoms and treatment. And the clinical features you are not just studying because you have to write in the descriptive part, but to identify the case scenarios. All the essay questions are asked in the form of case scenarios and you must read the clinical features, the signs and symptoms both in depth, in detail, so that a 15-mark case scenario you will be able to identify. Once you are able to identify the case scenario, once you make the diagnosis, then only you will be able to write it for 15 marks. If you make the diagnosis wrong, you will lose minimum 3 to 5 marks per question. Okay, so please don't make the diagnosis wrong. The fourth question, read all possible questions in infectious diseases. How far the endocrinology the weightage has gone high these years. Nearly 2 to 3 questions per paper they are asking in infectious diseases. That is, students will just read only dengue, HIV and all those things. No, please read leptospirosis, lung abscess. Many questions they are asking from infectious diseases chapter because again the growing trend of the newly emerging infectious diseases. Okay, so please make sure that you are reading all possible questions for both short notes as well as essays. You have to read, as I have told you, every essays, every chapter you must read. And the fifth one, never ignore the clinical features in every question because case scenarios, okay? The 15 marks, whether if you want to get or not, that is completely decided by the diagnosis that you make. If you make a diagnosis wrong, for example, instead of Alzheimer's disease, if you make Parkinson's disease, definitely 15 marks gone. So please make sure that you are reading the clinical features in detail so that will help you to get the 3 to 5 marks in that 15 marks questions. Because in the 15 mark question, there is, a split of marks like 3 plus 3 plus 3, etc. So in that, the first 3 marks is for the correct diagnosis. So make sure that you are doing that very, very clearly, or else, your future will be at question mark. Then, sixth question, always follow this priority. Students never follow this priority while preparing for this examination. So I am telling you, please follow this priority. Always CVS, RS, GIT, CNS, then endocrine, then infectious disease, rheumat and hematology. Previous year questions will be enough. Okay, most of the questions from rheumatology and hematology are previous year questions, but endocrinology, it's not like that. Infectious diseases, it's not like that. You read everything as possible. Okay, please read every possible questions in endocrinology and infectious disease. And of course, CVS, RS, GIT, and CNS should be at the tip of the fingers. Every essay, almost all the maximum short notes possible. Please make sure you read it. And the last but not the least one, yes, it is always told, every department, all my professor and head of the department always used to say, never go to a medicine final year university exam without studying these 3 things. That is, one is snake bite management as per the Government of India guideline, OPC management again as per the Government of India guideline, and the third one, alcohol withdrawal, alcohol poisoning, delirium tremens. All these things you will be studying in psychiatry also, but make sure that you are covering that topic with the utmost importance. So please never miss these 3 things. So these are the 7 things I would like to say. Every essays, endocrinology give priority, infectious disease give priority, read under the headings, read clinical features thoroughly, toxicology, these 3 questions. Hope this video helps. Thank you.